If you're considering or preparing for a medical abortion, we understand this can be a complex time, and you likely have many questions about what to expect. This video is designed to provide you with a clear, step-by-step walkthrough of the entire process, so you feel informed and prepared. It is crucial to remember that this content is for educational purposes only. Before starting any medical procedure, you must consult with a licensed healthcare provider to confirm it is safe for you and to ensure you have access to professional support. Let's walk through the steps together.
At your appointment at the clinic, first you will have a urine pregnancy test to confirm that you are pregnant. If your urine pregnancy test is positive, you will fill out and sign your medical history form, privacy form, and consent form. You will have an ultrasound exam in order to confirm that the pregnancy is under 11 weeks. We will then go over your medical history and explain how to take your abortion medication at home. We will also schedule your follow-up appointment with us in 1 to 2 weeks. We will also discuss birth control options. We will check your vital signs and iron levels. You will then take the first pill of mifepristone while seeing the doctor in the office. Normally, this medication doesn't have any side effects, so you are not restricted from your normal activity until you take your second dose of misoprostol at home. Note that you might get some spotting or light bleeding after taking your first pill, and this is normal. Very important. Note that you must take the second dose of misoprostol at home in order to finish the process, even if you have some light bleeding after the first pill at the clinic. Before you leave our office, you will get your second dose of medication, misoprostol, as well as anti-nausea medicine and pain medication, ibuprofen and/or acetaminophen, to bring home with you. At home, 24 to 48 hours after taking the first pill, you will first take the anti-nausea medication that we gave you at the clinic. Place it under your tongue and let it dissolve. Do not swallow it. Have some light food. Take your pain medication, ibuprofen and/or acetaminophen, with water next. You can also take ibuprofen and acetaminophen together or alternate for better pain relief. Continue taking the pain medication every 4 to 6 hours as needed for pain. 30 minutes after taking the pain medication, you will take 4 pills of your second dose of medication. This is misoprostol. There are 2 ways to take the second dose of medication. The buccal method. Place 2 pills between the gum and the cheek on one side, and the other 2 pills between the gum and the cheek on the other side of your mouth. Let them dissolve in your mouth for 30 to 45 minutes. If the pills did not dissolve completely after 45 minutes, you can swallow them with water. Vaginal insertion method. If you are very nauseous due to your pregnancy, we suggest that you take the misoprostol vaginally so you don't lose the pills due to vomiting. Please wash your hands, lie down, and insert all 4 pills of misoprostol, one by one, as deep as you can in your vagina. Lay flat on your back for 30 minutes for the pills to dissolve. If the ultrasound exam you had at the clinic showed that you are between 9 and 11 weeks, 4 extra pills of misoprostol were given to you. These 4 pills should be taken 4 hours after the first 4 pills were taken. You will start bleeding between 1 to 3 hours later. Bleeding would be the heaviest a couple of hours after taking the pills. It gets lighter in about a day, but some bleeding or spotting may continue. We recommend that you stay at home and do not plan any activities for this day. You might experience a slightly elevated temperature, cramping and pain, nausea, diarrhea, or upset stomach. These are all considered normal. You can ease cramps with pain medications, a heating pad, or a warm shower. Some things to keep in mind after taking all abortion pills. Your pregnancy symptoms will go away in a few days. Your fertility will go back to normal within a few weeks. Your next period is expected in 4 to 8 weeks. Your next period might be heavier than normal. If you take birth control, you should start taking birth control right away. It's okay to have sex, but make sure you are protected. Please contact our office if one of the following occurs. You have had no bleeding or cramping 24 hours after taking the second dose. You have heavy blood flow that soaks through 2 menstrual pads an hour for 2 hours in a row, and/or if the blood clots are larger than normal. You have nausea, vomiting or diarrhea that lasts for more than 24 hours. You get a fever of 100.4 degrees Fahrenheit or higher. You still have pregnancy symptoms. We hope this instructional video will help you with your medical abortion procedure. If considering the abortion pill, Women's Aid Center is here to help with accurate information, compassionate care, and complete privacy.